Physician-assisted suicide, a fundamental right for Canadians. Physician-assisted suicide, or PAS, is when a physician aids a person in terminating their life by providing a prescription of a deadly dose of medication for the patient to use with the intent of ending their life. Current law. Looking at the current law in Canada, specifically at the Criminal Code, we can see that if a physician assists someone in dying, then they are in violation of Section 241 and may be imprisoned for up to 14 years. Moreover, a physician who assists a patient to die can be charged with homicide under Section 222. Also, Section 14 points out that a person is not allowed to consent to their own death. What all of this means is that PAS is currently an illegal practice in Canada. What about people's rights? People have rights in our democratic society that are identified in the Canadian Charter of Rights and Freedoms. This means that the rights and freedoms are guaranteed as set out in Section 1 of the Charter, except for reasonable limits from the law that can be demonstrably justified. PAS not being a legal practice in Canada means that the law can be seen as an infringement upon Section 7 of the Charter, which is the right to life, liberty, and security of the person. This right should provide some assurance that the right to decide the time of one's death will be respected. However, the current law does not acknowledge this, and PAS is a prohibited act. Sue Rodriguez attempted to have Section 241 of the Criminal Code struck down as it violated Section 7 of the Charter. The Supreme Court of Canada denied her request to undergo PAS as a way of ending her suffering, and as a result, she committed suicide by convincing an anonymous physician to assist her in dying. The reality is, without having PAS as a legal act, individuals seek other alternatives to end their suffering in order to exercise their right to life, liberty, and security. The decision in this case was based on Section 1 of the Charter, which allows limits on our rights and freedoms when it can be justified by the government, and therefore they did not believe her right to Section 7 in the Charter was violated. The government's concern was protecting vulnerable people and the value of life. The Carter case is very similar to the Rodriguez case. However, the outcome is very different and is one of the biggest Supreme Court rulings in history. The Supreme Court of Canada agreed unanimously that prohibiting PAS does violate Section 7 of the Canadian Charter of Rights and Freedoms, but the courts will require 12 months to make amendments to the current law. What this means is that PAS will be legal for a competent adult person who 1. Clearly consents to the termination of life, and 2. Has a grievous and irremediable medical condition that causes enduring suffering that is intolerable to the individual in the circumstances in his or her condition. The case of Carter was not bound by the Rodriguez case law due to the fact that the trial courts may reconsider settled rulings of higher courts in two situations. 1. Where a new legal issue is raised, and 2. Where there is a change in the circumstances or evidence that, quote, fundamentally shifts the parameters of the debate, and both of these requirements were met in the Carter case. The proposed Bill S-225 is an act to amend the Criminal Code in response to the Carter case. Essentially, it is adding exceptions to Section 14 to allow individuals to consent to their death by means of voluntary euthanasia by requesting PAS, and that the physician will not be able to be charged with homicide by providing PAS. Section 241 has proposed several conditions that must be met in order to make a request, such as what assessment should take place and what responsibilities the physicians will have, to name a few. There are many advantages to PAS being legal. It provides an alternative to poor palliative services offered in Canada, provides more autonomy for patients, and acknowledges that respect for autonomy. Patients don't have to endure unbearable suffering. Patients don't have to travel to other countries in order to receive PAS. It also allows patients to die at home on their own terms. It shows a sense of compassion towards the individuals who suffer. It provides a choice at the end of life that allows the individual to have full control over their end-of-life care. Those opposing PAS have highlighted some concerns that need to be addressed. They argue that PAS will affect the palliative care system, even though this hasn't happened in other countries that have legalized PAS. In fact, the quality of palliative care in other countries that have legalized PAS is better than the quality of palliative care in Canada. There is also the concern that vulnerable people could be at risk for non-voluntary euthanasia. This can be defeated by considering the ruling of Justice Smith from BC, who states that the risks inherent in permitting physician-assisted death can be identified and very substantially minimized. The Hippocratic Oath that physicians take states that they will do no harm. Opponents to PAS say that PAS causes harm. This cannot be true, as it ends patient suffering. Finally, those opposed to PAS argue that legalizing PAS leads to a slippery slope. Yet, what they fail to mention is that there is absolutely no proof of this occurring in any other country or state where PAS has been legalized. As such, the aforementioned claims cannot be substantiated. Policy concerns include capacity and voluntariness. People who consent may not actually have the capacity or competence due to depression or impaired cognitive ability. As such, physicians can utilize the Understand and Appreciate test that tests cognitive abilities to understand the patient's mental capacity as a basis for legal capacity. This can help identify if the patient understands and can appreciate the consequences. Quebec utilizes Bill 52, which has a safeguard that requires a waiting period between a formal written request and the act itself. Both stipulate that 2 doctors assess the patient's competency. Also, Justice Smith is confident in the ability of doctors to assess patients to determine if they have capacity, and she has faith in safeguards in place to protect patients. In assessing voluntariness, patients may be coerced or pressured into asking for PAS. This requires that physicians look at external influences, and the physician should know the patient very well. Questions. What if a patient is physically unable to take the medication independently? Can someone administer it to them? Is that considered murder? Why or why not? With the baby boomers aging and the stress on the healthcare system increasing, do you think that physician-assisted suicide will be used as a means of healthcare cost containment? Will physicians suggest this alternative more frequently to lessen the burden on the healthcare system? Consider that the cost of medications to end life is much cheaper than the cost of medications to sustain life. And these are the references used for this presentation. And I'm just going to end it off with a comic just for fun.